Hello and welcome to Dragon Bytes, the paediatric podcast aimed at paediatric trainees or anyone interested in child health. I'm Asim, one of the paediatric trainees here in Wales and one of the presenters for Dragon Bytes. This week we've got another one of our careers episodes, all about applying to the Renal Grid programme. Rebecca Jones, one of our newest Dragon Bytes hosts, is joined by Dr Ash Gutpa, consultant paediatric nephrologist at Birmingham Children's Hospital, and by Shouja Alam, nephrology grid trainee, also based at the Birmingham Children's Hospital. In this episode, they discuss the interview for the nephrology grid programme. So, let's get started.
Shouja, how about yourself? What was the thing that drew you to peds and peds renal?
Yeah, well, I always enjoyed working with children, right? Since I was a child myself and a teenager, I was always involved in youth work some way or another. So it was very natural at medical school when I did my pediatric rotation. I just knew that I was going to take to it very well. I was a medic at heart, and pediatrics in itself was all of general medicine, but it was all in a pediatric context. And as Ash says, we see a huge variety of patients, right from, even when they're in utero, we get involved as pediatricians and give advice. And we need to know about the embryology of developing organs and how that impacts on life thereafterwards when there are problems, very relevant for renal medicine. And then we basically see children at different physiological ages, and they have different diseases because of that, and different manifestations of disease, and they have to grow and they have to learn. And this was, general medicine with all of this beautiful nuance, which meant actually pediatrics was a no-brainer. And especially as a medical student, I was also a scout leader. I mean, it was pretty much made. It was a decision easily. It was an easy decision for me. And then I did my elective in pediatrics in a tertiary hospital that was abroad, and that just allowed me to see all of the kind of severe pathologies that I'd read about during my placements, and then I was set. Just like Ash, I tasted lots of different specialties, and unfortunately, the way the training is at the moment, by the time you get to kind of ST3, ST4, you may not have really tasted all that many subspecialties. You might have just come across them in your work doing the rotations through neonatology and general pediatrics and community, which are of course the core things that you have to do. But I was lucky enough to ask for experience in those jobs that I was particularly interested in. And one of them was my renal placement, and that solidified it for me, really, because for many of the reasons that Ash said. So I won't repeat those. But what I would say is that I loved as well the idea of transplantation. I thought that was incredible to be involved in a specialty that's involved in transplant. And I was particularly interested because during this training of mine, my brother in law was facing end stage renal failure. And he kind of quite suddenly went into that state. And I had seen someone very close to me go through renal replacement therapy and really struggle with it. And I've also seen how transformative the transplant was for him. And he's my age, actually. And I've known him for a very long time, even before we were married. So I have very personally seen just how special this is for patients and their families and their friends. And when I got to taste a little bit of that during the job, again, that really confirmed for me that this is definitely a fulfilling and worthwhile a kind of specialty to be involved with, as well as not having to just think about a single solid organ. I love nephrology because there is impact on the whole body, and you still have to be a good generalist, I believe, to be a nephrologist. and I didn't want to lose that element of my practice as well. And that's probably, if you were to ask me, the most rewarding part of the job, I really do still feel, and I'm sure Ash would agree, that magic of, when patients, especially when they've had a rough time on renal replacement therapy and have really gone through the trenches, and then they have their kidney transplant that they've been waiting for. And, yes, there are ups and downs with that, but that is hugely rewarding.
Yeah, I think when I was lucky enough to work with you guys, that was some of the magic when we had children that came in for their transplant, or even those ones that were on dialysis. So I think I've seen a little bit of that magic myself with you guys. What can trainees then do? They've been offered an interview. What can they do to prepare for that?
The first thing I would say is just to um, try and find out a little bit, to demystify the interview process, just to try and find out what it's actually like, because part of it is just mentally preparing, I think. And so I'm sure, as you speak to other grid trainees or people that have gone through a grid application process and an interview, you'll know that they take place well, they have previously taken place in the RCPCH building in London. Obviously, with the current COVID climate, things will be done virtually or differently for this year. But part of the game was just to appreciate that it's going to be in this kind of fancy building, and you're going to be going in and signing in, and it's going to be a little bit of a formal setting. But if you just kind of appreciate that and expect it, know that they're going to be a number of nephrologists, on the opposite side of the table, kind of thing. These things would otherwise be daunting, but if you're expecting them, and they're going to be around the corner, then actually you can just turn your anxieties off about it and just focus on what's going to happen, and that you've done all the preparation, and you're going to give it your best shot. So I think the first thing is just knowing what the situation is going to be like, and knowing what's actually going to happen. So if you want, I can tell you a little bit about what the typical interview process used to involve, and it was the same pretty much every year. So shall I go ahead with that, Rebecca?
Yeah, I didn't know if there was anything Ash wanted to add before you give us a typical overview, Shouja. Was there anything else you wanted to add about getting ready?
I think you need to know the format of the interview, like Shouja said, the length of the interview, who's typically on the panel. Normally, they would have specified people on the panel, and they would have, as well as having usually 3 paediatric nephrologists, you'd have 1 lay person, and you'd have somebody from the college representing as well. Um, so I'd familiarize yourself with that, and I would do basic things like, for example, make sure that you've got a CV so you know all your selling points, and then go back to basics. I don't know if the trainees will remember what they had to go through to get their pediatric training number, and what they did at that time. And I remember having the CTST interview book that gives you all the structures to the answers that you would give at during the interview. And I went back to that actually. I went back to that basics initially, and just wrote down what my answers would be according to that book. And then I built on to probably what Shuja's going to talk about, before I had practice interviews with other consultants that I was working with. But I think, Shuja, what you were going to explain, I think, would be really beneficial to everyone.
Sorry, Shouja. I'm just conscious that Ash said she needed to go around now, so I just wanted to check whether Ash was okay or whether you needed to dash.
Yeah, is that all right? I do need to leave. Is that all right? Do you need to ask me
Is
anything
there
else?
anything else you want to add for us? Because we can stitch it in if there was any final things you wanted to say.
One of the things I was going to say before I go is um, that trainees should keep a close eye on the RCPCH website. This year they had the grid application process virtual interviews. It was a live Q&A session, and I think that's really, really helpful to know and to highlight any differences from year to year, because things will change. And and so that they should keep an eye out for that. But apart from that, I was just going to say that I'm sure Shouja will agree that if anybody wants to ask any specific questions after this, I'm more than happy for my email address to be added on to anything, if people wanted to ask any specific things, or if they had any questions that I didn't answer today. But thanks so much, Rebecca and Asim and Shouja.
No, thank you for joining us, Ash. Right, sorry, Shouja, I was just conscious that Ash said she needed to go. So back to that. So if you lead us through what a typical interview might look like, I think that would be really helpful for trainees.
Yeah, sure. And actually, just something to add that came to my mind, just as you're trying to think about getting ready for the interview, one of the things that you might think of, and I was certainly a little bit worried about, is, gosh, how much nephrology do I need to know? At this point, and despite people telling me that they are looking for a candidate to go into nephrology training, they're not looking for a nephrologist at this stage. Not a tertiary nephrologist. So um, don't necessarily worry yourself about getting all of pediatric nephrology into your head just for the case of this interview. No, what they're looking for is a broad understanding about key issues in nephrology that would be important for a general pediatrician to be aware of. Things about, for example, dealing with acute kidney injury, for example, and resuscitation in a kind of a nephrology patient kind of context. Let's say someone who's got AKI, or someone. In my case, it was a patient with kind of bloody diarrhea, and they were shocked, and it might be that they were developing hemolytic uremic syndrome, but something that you might actually come across in general pediatrics. They're not going to try and put something so specialized that only a tertiary nephrologist is really going to be able to tease that apart. It's going to be general and basic stuff, and they're going to look for your approach. But if you did want things to read around, I would highly recommend, in the first instance, looking at things like InfoKid. InfoKid is .org.uk. Is a resource website, information which is tailored mainly for patients and their families, and they've got some information for professionals as well. And it looks at the main kind of conditions that kidney patients face, and it's actually in a language that's very easy to digest, and it will give you lots of the issues that are actually probably more than enough of some of the specific nephrology stuff, and an awareness of what kind of pathologies and problems that families have. And I think that's an excellent thing to just look through and help you prepare for the knowledge base for the interview. Um, and Yeah, I think that's probably the main thing. I wouldn't necessarily try and make sure you've read through the whole of the pediatric nephrology handbook, for example. I think it's just really how you're going to approach the scenario. So I'll take you through what a typical interview involves. What it used to involve is going to the RCPCH building and signing in, and then waiting to go to a separate room where you would have to prepare your presentation. So one of the things that you have to do as part of this interview is to prepare a presentation. It's a short presentation. It's about, I think, 5 minutes in length, but they will give you the topic there and then. And then they will give you a certain amount of time. I believe it was 10 minutes or so maximum to prepare your presentation on a laptop that they will give you. So you prepare those slideshows, and the key thing there is just to make sure that there is a beginning, a middle, and an end, and that you've thought about that problem. And it's more about just your ability to relay information, think about a problem and analyze it, and try and make sure that you're tackling different facets of it. And they just want to be able to see that you can do that. It's nothing more complicated. They'll choose a new topic each year. My interview, it was about organizing a regional teaching day, and how you would approach that problem. one tip that I would give, if it goes back to a physical format, is I was in that room preparing that presentation with other trainees that were preparing their presentation, but they were for different interviews for different specialties, and different specialties had different lengths of time that they were allowed to prepare their presentation. So I saw some other person that I didn't recognize in the room, and I thought, oh, that's great. So when they get pulled out, I know that it's close towards my time being done. And that's what I'd assumed. So I thought that I still had plenty of time because that other person was around. And then my time had actually finished, and I didn't actually get to complete the very final slideshow, a slide. But do you know what? That didn't matter at all. If something like that happens to you, it does not matter. And they just wanted to be able to see that you can stand up and be coherent. That's all. And that was absolutely fine. The next thing, so when you're in the interview room and you do have that panel that we talked about, usually there would be at least one of them will be the CSAC chair, so they will definitely be there, and then some other nephrologists, and as Ash said, the composition as she mentioned previously. But there will be about 5, maybe 6 individuals in the room, so just be mentally prepared for that. And they will each have a particular question to ask you. And whilst they ask you that question, they will have a structured format to be kind of scoring you. It's kind of like a driving test. You would expect them to be scribbling and writing whilst you're talking, but really they do try and be friendly. They don't try and grill you. They don't try and belittle you. Yes, they are all sitting at one end of the table and it's against a big window, and but on the whole, almost everyone was smiling and nodding along, and they were trying to basically be as friendly as they can, but be prepared. They need to be very structured, and they need to be quite kind of similar between candidates. So they are not really allowed to converse and really have back and forth discussion about the case or the questions. They would kind of expect you to freestyle and just go solo. So that can be disconcerting. But again, if you mentally prepare for it and you know that, okay, they're going to ask their question and then it's down to you. So the kind of questions they ask, there'll be 2 cases. One of the cases is typically kind of like an acute kidney injury case. And I told you my case was in the context of probable hemolytic uremic syndrome and AKI secondary to that, and probably an element of dehydration. And then there'll be another case which would be more of a chronic kidney disease situation. And I think my one was about a boy with CKD who had also learning difficulties and neurodevelopmental problems and was being worked up for a kidney transplant. So again, it sounds very specific, but I think it was really trying to get you to think about ethical issues that are involved, ethical issues about competence and consent and multidisciplinary team working and having a psychosocial approach to the patient and their families, and whether certain treatment modalities are ethical in terms of fair utilization of resources and maleficence and beneficence, non-maleficence and beneficence, and all that stuff. So these are the key things that they will try and get out from these cases. And from the acute case, they will always expect you to try and approach in a methodical, structured manner. So that's, of course, an A, B, C, D, E approach to your assessment and to your plan. And that's what they want to see. At the same time, they would love to be able to see you appreciate some of the nephrology aspects. And again, you don't have to be a tertiary nephrologist, but to be able to identify that, a child is, for example, hyperkalemic and has significant renal dysfunction. So that's a problem. That they are acidemic, and that, these things would fit in with an acute kidney injury, for example, that they are quite anemic in this case. And so that would fit in with hemolysis. And we might need to think of a blood transfusion. And if you can show off some of your understanding in nephrology, that would be brilliant, and that would just give you bonus marks. But as long as you have a structured approach which is safe for your level of training, then actually that's all they're looking for, and that's what they want. And you don't need to. I spoke to loads of people grid trainees that did not know the case that they had. They don't know the diagnosis. They felt like they were flustered, but they did okay. They did absolutely okay, even if they didn't come to a diagnosis, because they just had a methodical approach. So I would highly recommend to keep a structure, and the structure that I would say is to use an S-bar. I know that we use S-bar for communicating and handovers, but actually you can use an S-bar to approach the analysis of a problem. So you can kind of look at it, you can, once they will read through the question for you, word for word, verbatim, and then what you might want to do is say, okay, well, let me just read through this again, and I'll the situation, as I understand, is X, Y, and Z. And I can see that the background for this child is that they, have learning difficulties and or other comorbidities. And so, if I were to assess this child, I would use a systematic approach: A, B, C, D, E, and so forth. And then your recommendations again can be, your plan should be systematic. So that's what I would say. If you just approach that clinical problem with some kind of a systematic approach, and then wrap it up at the end and make it clear that you've wrapped it up, that means that they can see a beginning, a middle, and an end, that it's been logical, that it's been safe, and I think that means that they would be happy. And as long as you're not flustered and expect that kind of an approach, I think you guys will be absolutely fine. The other questions that they will ask, one is going to be about a research topic. So this can be a little bit daunting, but if they will just ask about a problem. In my case, it was, how would you approach a research project for a rare disease, I think it was. So here, I think, some knowledge, some background reading on different kind of study designs and the pros and cons of each of those would be important. But then also just maybe an appreciation of some of the big projects that are happening right now in nephrology. And you can get that information by going to these conferences and reading up on the BAPN website, or the KQUIP website. That's KQUIP. That's a branch of BAPN. That will give you an idea of what kind of national projects are running at the minute, and that will give you an idea about how we are approaching research problems in nephrology, and it's along those lines. I think. So we talked about presentation, AKI, the two clinical cases, the research, and of course the two questions that you're absolutely guaranteed to have. One of them will be, I'm sure you can predict it, why nephrology? And the other one would be, why choose you over someone else? And I think these two questions you should really have. You've already thought about it for your application, but there is no reason why this shouldn't just absolutely flow and be completely prepared for. Because that's a no-brainer. But try your best to get as much in, know your selling points, know your CV, and get as much in as succinctly as possible. And don't undersell yourselves, because you guys, I'm sure, have so much to sell, and make sure it gets through. Don't just rely on something being on your CV or on your application form and therefore it'll count. No, make sure it comes out in the right place.
That's amazing, Shouja. I think you've given us all loads to think about. And I think you and Ash said it, that us as medics are really bad at selling ourselves. We often shy away from it. And for things like interviews, we really need to be better at knowing what our strengths are, because I think everybody has more strengths than they give themselves credit for. I think you've covered everything we wanted to go through today. I guess picking up on that last thing you said about one of the questions that will definitely come up, why renal? As a grid trainee, for other trainees out there who maybe haven't decided on a specialty yet, who are listening to these podcasts like I do, not being anywhere near to grid application yet, why should they choose renal over other specialties?
I think to some degree it is going to be subjective based on your experiences, but I do think nephrology is an incredible specialty, for the reasons that we said at the beginning of the interview, really. But I do think that it offers, actually, in addition to what we said before, a good work-life balance, actually. And I think that's important when you're thinking of consultant careers, that that you do have a subspecialty interest, that actually you might be protected by some of the kind of heavy workload that unfortunately we do see falling on the shoulders of my general pediatric colleagues. And I love general pediatrics, and it is one of my passions. But when I see the direction that that things are taking, and they may not last forever, but I do think that junior consultants are being asked to take on a lot more than they ever used to, and I think that is something relatively protected in subspecialties, and in particular nephrology. I think nephrology is great because you can deal with a lot of things on the phone, but you need to develop that skill of gaining as much information as you can, relevant information, and actually giving safe advice on the phone, but which you can do quite skillfully, actually, and quite effectively. That may not be applicable in many other specialties. And actually, it's quite satisfying to see how your advice, and going back to the physiology and a little bit back to kind of some kind of electrolyte disturbances, some calculations, and it's really satisfying to see how your remote advice actually pans out and makes and makes a difference. And that's that's really quite satisfying. And at the same time, it's not all remote. There's lots of cool acute stuff that's happening in hospital itself, that keeps your hands busy. And we've got our own like practical skills as well. So I love doing renal biopsies. I mean, I'm sure everyone's got their particular things that they love doing, like lumbar punctions. I used to love doing lumbar puncture. I still do. I still really quite enjoy it. And every time the CSF comes out, it gives me a little buzz. And I get the same thing when I hand over my little piece of kidney to the pathologist. There are these little quirky things that that's why. In addition to all the stuff we said at the beginning, which is equally true, but I do think nephrology is well worthwhile going for. Yes, it is competitive. It is probably one of the smallest specialties that you'll be applying for Grid. So they might only be appointing, 6 people, 7 people, which will be very different to, neonatology or community pediatrics. But you know what? I went into this thinking, well, it's worth a try. It's worth a try. And, and I was really happy, and I wasn't expecting to have scored as well as I did. And actually I chose Birmingham as my first choice, and I got it as my location. If I wanted to have chosen London, I would have got that as well, because, they seem to be quite happy with my application and my interview. So don't underestimate yourselves. You guys have had loads. And I came out of that interview thinking I absolutely botched it. I came out thinking it was a complete, like, I was convinced that it was a goner. It was an absolute goner. And the girl and my colleague, who's now a grid trainee with me, she also came out of the interview, and we went for a coffee afterwards to pick each other up, because we were like distraught, and we thought, that's it. It's gone completely pear-shaped, just because we felt like you don't get any feedback from them, and you keep questioning yourself. Did you go down the wrong way? Did you completely miss the point? And she said something different, I said something different, and but you know what, we both got in. We're both like we're both doing well, and you never know. Just give it a go.
I think that's an excellent sentiment to end on. Just giving it a go and shooting for something if you want it is an excellent sentiment to end on. So thank you very much.
Not at all. It's my absolute pleasure. Thank you for inviting me. And I agree. I think this is an excellent project. I wish I had all of this information in one place, in one go. So I really do think it's going to help loads of people. So thank you very much.
And I just wanted to say thank you to Ash and Shouja for joining us for these podcasts, and to Rebecca for hosting them for us. Join us again next week for another episode of Dragon Bytes. Thank you for listening.